Hey guys, welcome back. This time around we want to talk about the physiology of the autonomic nervous system. Now when you're looking at the physiology of the autonomic nervous system, you got to keep three players in mind. One of those is the releasing fibers. Now that's the term that describes the axon that is coming to the synaptic cleft, and it's going to be described based upon the neurotransmitter, the second player, the neurotransmitter that is being released by that releasing fiber. And then the third player is going to be at the target site, the target organ, and it's going to be the type of receptor there that can bind to that neurotransmitter. The two key types of neurotransmitters that are going to be found in the autonomic nervous system are going to be acetylcholine and norepinephrine. This is the same acetylcholine that we also see released from the axonal terminals of the somatic axons. In the autonomic nervous system, acetylcholine is released from a cluster of fibers known as the cholinergic fibers. The other type of releasing fiber, adrenergic fibers, release norepinephrine at their axonal terminals. Now, it is not necessarily solely the responsibility of the neurotransmitter to determine whether there's going to be an excitatory or inhibitory effect when they bind at the target site. A lot of times that heavily depends upon the type of receiver that is found on that target site. So what we need to do is take a look at the fibers, consider that the neurotransmitter is being released by each one of these types of fibers, and then look at the different types of receptor sites that we have at the target cell. So let's get started with the cholinergic fibers. Again, the cholinergic fibers are going to be the acetylcholine releasing fibers. They're going to be found on all preganglionic axons of the autonomic nervous system, all the parasympathetic postganglionic axons at the synapse of the effector organs. There's going to be two types of cholinergic receptors on the effector organ surface that will bind to acetylcholine. Now these receptor sites are going to be named after chemicals and or drugs that will also bind to these sites and mimic the effects of acetylcholine. The two types of receptors are going to be nicotinic and muscarinic receptors. Nicotinic receptors get their name after nicotine because nicotine will have a similar effect on their target sites. Now nicotinic receptors will bind to acetylcholine, and nicotinic receptors will be found at the motor end plates of skeletal muscles, all ganglionic neurons, both parasympathetic and sympathetic, and the hormone-producing cells of the adrenal medulla. The receptors always function to stimulate an excitatory response with these nicotinic receptors. The other type of receptor that will bind to acetylcholine is going to be muscarinic receptors. Now, muscarinic gets its name from muscarine. Muscarine is the poison that you would find in killer mushrooms. Now, muscarinic receptors are going to be found on all effector cells stimulated by postganglionic cholinergic fibers. That would be your parasympathetic, and some sympathetic targets such as sweat glands. Now, the stimulation that occurs from the muscarinic receptors and the acetylcholine binding to the muscarinic receptors is going to be dependent on the parasympathetic target. The second type of fiber that we have is the adrenergic fibers. Now recall that adrenergic fibers are going to be those fibers that release norepinephrine. Now the adrenergic fibers are going to be most sympathetic postganglionic axons, except for those innervating sweat glands and blood vessels of the skeletal muscles, and also those associated with the external genitalia. As we described previously, and keep in mind when we're talking about these, if norepinephrine is a stimulatory effect when it binds to the receptor, then it's going to be much similar to what we've talked about norepinephrine in the past as being a feel-good type of hormone or neurotransmitter. There's two classes of adrenergic receptors. There's the alpha and there's the beta. Alpha is usually going to be stimulatory. It mimics what we find when we think of over-the-counter drugs that we use for things such as colds, allergies, and nasal congestion, because if you think about it, those drugs are pseudoephedrine usually. Now, pseudoephedrine mimics norepinephrine. Now, when you look at the alpha, you see that it's going to be subcategorized into alpha 1 and alpha 2 type receptors. Alpha 1 is going to be the most importantly regulated blood vessel servicing the skin, mucosa, abdominal, visceral, kidneys, and saliva glands. Notice it's going to cause a constriction of blood vessels and vascular organ sphincter, and while dilating pupils. The beta, on the other hand, does come in three forms: beta 1, 2, and 3 here in our table. Beta is usually going to be inhibitory, but can be stimulatory. Now notice that beta 1 has a heavy influence on heart rate and force of contraction. This is the one that we'd want to block if we're trying to oppose hypertension. And we would use something known as a beta blocker, and that beta blocker would block B1 typically. On the flip side, notice that B2 influences the lungs and has effect mostly inhibitory, causes dilating blood vessels and bronchioles, relaxes smooth muscles, walls, digestive and urinary, as well as the visceral organs, and relaxes the uterus. Now in this case, we might actually use something called a beta stimulator or stimulators. This is a cluster of drugs that would attack the beta 2s. And when it attacks the beta 2 receptors, it binds to those receptors and mimics the effects of norepinephrine on the beta 2s. Where would this be relevant? Somebody who's having an allergic or an asthmatic attack. Typically, drug effectiveness depends on knowing the sites of the receptors. This knowledge allows us to manipulate the receptors and the responses. As in beta blockers we just saw, we can actually design drugs that can reduce heart rate and prevent arrhythmias by complete inhibition of the beta sites of the heart. Now, a beta blocker does as it sounds, binds to that site and prevents epinephrine from binding to it. Other examples, though, would be things like our tricyclic depressants that help relieve depression by prolonging the effects of norepinephrine at the postsynaptic membrane. That's that feel-good effect of beta 2. Now here in this table that we see here are a number of other drugs that and their effects upon either the cholinergic or the adrenergic fibers and receptor sites. You guys have a great day.